All right, welcome everyone to CASA Choices for August. Tonight we're thrilled to have Dr. Phillis Dewitt with us. Dr. Phillis Dewitt is a mother, grandmother, former foster parent, professor, and nurse practitioner. She also went through the foster care system as a child and became an emancipated minor at the age of 16. She started nursing school at ICC with 9 children at home, then went on to earn bachelor's, master's, and doctorate degrees. She now teaches in the graduate nursing programs of 4 universities and works as a nurse practitioner. She has traveled worldwide on over 30 medical mission trips and helped start a medical clinic in northern India. Thank you, Phyllis. We are really happy to have you for our attendees tonight. If you have questions that come up during Dr. DeWitt's presentation, please drop them in the Q&A box. And at the end of her presentation, we will have some time to do some question and answer. So with that, Phyllis, I will turn it over to you.
Awesome. Thank you. I am so excited to be here. This is just a great opportunity for me. And if you want to go ahead and start the PowerPoint, I'll tell them a little bit more about me. You already covered most of it, so I appreciate that. But I am a nurse practitioner. I became a nurse over 20 years ago. And honestly, it was one of the best decisions I ever made. So let me just cover a few of the objectives that I think we'll go over tonight. One of the things that I really wanted you to know is that there are a lot of healthcare options that you can even start exploring in high school. And, you know, many of these opportunities are available at your local high schools and even at ICC while you are in high school. And so, you know, for me, I'm going to cover the career of healthcare and nursing, how to explore these options while you're in school, how to accomplish this task with honestly very little money. The versatility that nursing has. There's been just so many different jobs that you can do in the nursing fields, and there's so many rewards that you have in healthcare and that I've had in healthcare. And then last but not least, the many opportunities that I've had to work in my local community, all throughout my state and worldwide. So I just want to cover a little bit about that. And then onto my background. I'm probably the most unlikely person that anyone would have ever suspected that would have gone to college. So I want you to just be able to know that regardless of whether or not you think that you're a good college candidate, I definitely did not think I was a good college candidate. My biological parents only went to 8th grade. My grandparents didn't even go to 8th grade. No one in my immediate family had ever gone to college. Both my husband and my families both came from very poor backgrounds. As you heard earlier, I was a foster child. And then at the age of 16, I became an emancipated minor. I lived on my own, had my own apartment, worked 2 jobs, and college just didn't seem to be in the cards at that point. I got married very early and had 3 children under the age of 3 by the time I was 22, and still had not gone to college. So I just didn't think it was going to be in my cards. But you know, my journey towards nursing, like I said, you can go ahead and switch. Oh, I've got the slide. There we go. No. There we go. Thank you. My journey towards college, like I said, I had 3 biological children, but I had also become a foster parent at that point. And so I had run a home daycare for many, many years, and then started doing foster care. And at the time that I actually started nursing school, we had 9 children living in our home. And 8 of those were 3 biological, 5 foster children, and then 1 foster child who had aged out of the system but was still living with us. And so I just thought there's no way I can go to college. But one night I had a dream, and my husband was very healthy, and there was absolutely no reason to think that he would be sick or get sick or anything. However, in that dream, it was very clear to me that if something happened to my husband, there was no way that I could financially care for these 9 children. So next slide, there we go. And so I told my husband about the dream, and he kind of laughed it off. And he said, I'm not sick. There's no reason for you to think about this. I don't think you should go to school. We have too many kids living here. But this dream just kept plaguing me. And so I started investigating what I could do. And I saw that Illinois Central College actually had a community program where I could get a nursing degree in 2 years. So I talked to my husband some more. He really wasn't happy about it, but he said if I could manage the home, care for the kids, and go to school, then he would be supportive. Some of the reasons that I chose a community college is raising 9 children. I just knew that, you know, an expensive college was not a good choice for me. I knew it was closer to home. I didn't want to be far away from my kids. I knew I could get it quickly. Illinois Central College offered a 2-year program, and some of the other colleges were 4-year programs and were much more expensive. And there were lots of many different scholarships that I could apply for. And one of the things that I learned is anyone who had been in foster care after the age of 13 qualified for federal funds. And I had been in foster care after the age of 13. And so I knew I could fill out the FOSFA and qualify for some funds. One of the things that I fell in love with ICC about was that I just loved my professors. They were so down to earth. They were so kind. They were just really helpful. I loved the campus. It was small, and yet it was big enough to give the college feel. I love the cost. I love the administrative support. They kind of walked me through everything that I needed to understand, and the paperwork and the financial aid. And I was able to go to school and graduate debt-free, which was really important to me. And through that 2-year experience, I fell in love with learning. And it was something that I was really good at. I didn't find the courses hard. I found they just energized me. Now, I did a lot of late night studying at home, but I was just really energized by everything. So it was exciting to graduate debt-free. Many, many years later, I was able to go back and speak at commencement, and I actually received an alumni award from Illinois Central College a few years ago. And now my husband and I actually fund 2 scholarships, endowment funds, where we help other students go to school. And one of the parameters around our scholarships is that the student have some connection with foster care or the foster care system. So we support 2 at Illinois Central College, and we support 2 at St. Francis Medical Center College of Nursing. And we really thought it was important to give kids that either grew up in foster care or kids that their parents were foster parents, but that had some connection with the foster care system, an opportunity to have additional funds while they went to school. So there's many different roads that lead to nursing. And one of those you might explore at your local high school. And I'm not sure high schools that each of you may attend, but many high schools have CNA programs that you can go half a day your junior and senior year, and you actually graduate as a CNA, so a certified nursing assistant, and you can take the test. And there's actually, with Methodist College of Nursing, they have an 8-week program that, as long as you have a 2.5 GPA in your high school, and you can do a study program with your high school, then in 8 weeks you can become a CNA, and they have scholarships. ICC's just recently been granted, I think, over $200,000 of scholarship money to help those students that want to get into healthcare positions, and particularly into CNA programs. And so when you can get your foot in the door as a CNA, many of your healthcare organizations where you would get a job will actually pay for you to then become a nurse. And so I really try to encourage many, many students to start on the CNA level, and then they can usually get the majority of their education paid for from the organization that they're working with. And there's plenty of local and statewide scholarships. And one of the things that I tell people about is when I went and got my master's degree, not only did they pay my full tuition, but they actually gave me an additional $5,000 a year to go to school, paid my tuition, and then did a loan forgiveness program. So any student loans that I had, they forgave them as long as I would teach in the state of Illinois afterwards in a nursing program. And so that was one of the reasons that got me into teaching a little bit. But so when you're looking at these pathways, there's multiple different pathways. Licensed practical nurse, Illinois Central College has that program, and it's about a year, and you can become an LPN. So, those that have already maybe gone to an 8-week program to get your CNA, then you can have your organization pay for that 12-month program for you to become a licensed practical nurse, or your organization can pay for a 2-year program to get your associate degree in nursing, where you come out of school working as an RN, or you can get your bachelor's degree in nursing. And all 3 of those paths are really good ways to get into nursing. So I wanted to talk a little bit about some of the starting salaries, because I have people that ask me that all the time. And it really depends on what organization you're working for. So with a CNA, the starting salary in this particular area, in the Tri-County area, is about $16 to $19 an hour. But there are some nursing homes that are paying significantly more than that for CNAs. So there's just a wide range of salaries there, but on average, $16 to $20 an hour. For an LPN, it's on average $19 to $21 or $23 an hour. Some nursing homes, again, pay $25, $28. For an RN, registered nurse, you start off between $27 and $28 an hour. I know OSF, and I believe Methodist as well, or Unity Point as well, just increased their registered nurses' salaries to an hourly rate of, I think it's like $28.35. Again, nursing home salaries are often much higher, but some of the benefits that you get. So insurance, we all know what the cost of healthcare has done, and how, we need insurance for our families and for ourselves. And so insurance is usually a huge benefit that's provided, and that includes medical and dental and eye vision insurance, tuition reimbursement, which is a great opportunity, like I said, to get your school actually paid for. 401k plans where you contribute so much and they'll match it. And that's really a positive benefit, especially as you move further along in nursing. You start to realize the benefits of 401k matching programs, retirements, paid vacations. Many hospitals right now have significant sign-on bonuses, and then some have actual loan forgiveness. So if you end up having to get a student loan, then they will forgive up to, some of them are $5,000 a year for every year that you work for them. Some are $10,000. So it just depends on what the organization is that you end up with. But so let's talk about a little bit of salaries even outside of registered nurses. But if you look at the highlighted 2 registered nurses, there's a national average and then a registered nurse salary. And so there's some states that have a much lower salary, obviously, and some that have a higher salary. But being an RN is foundational for becoming an advanced practice nurse, which is what I am. And so the nurse midwife and the nurse practitioner and the nurse anesthetist, those are all advanced practice nurses. And those are people that have gone to school 2 more years after they get their bachelor's degree in nursing. and have specialized in a particular area. And as you can see, those salaries are significantly higher. So if you look at the nursing assistant and then the LPN, the registered nurses, nursing instructors, that's another great opportunity. And I'll tell you a little bit about my opportunities as a nursing instructor here in a little bit, but and then advanced practice nurses. So there's many, many things that you can do as an RN. So this is one of the things that I always tell people. If you get into nursing and you get into a job that you say, you know what, I'm just not sure this is for me, I guarantee you there are 30 more registered nurse jobs that you can try, and most people love one of them. I can honestly say I've never, ever had a job in nursing that I wasn't completely, totally in love with. And I've worked in many different areas. But as you see here, you can be a camp nurse, a full-time school nurse. You can work in acute care. You can work in the emergency department. I worked as all the red ones on this screen are jobs that I have actually held or that I currently hold. But you can work as a life flight nurse, health department, cardiac nurses. Anytime you go on a cruise ship, you're going to notice there's an RN there, so a registered nurse there. So you can travel the world on a cruise ship. You can work in surgery. You can work in delivery room. There are so many opportunities. And I even have another slide, and I won't, I'll show it to you, which is next. But if you look at that, it's just unbelievable. Not only the amount of jobs different kinds of jobs that you can get, but even the different certifications and specialties that you can study even after you become a nurse and even become more specialized. So as you can see here, there's countless, endless opportunities if you get into healthcare, and especially as a nurse. So my education, let me tell you a little bit about my journey. I started at Illinois Central College, loved it, it was great. It's a 2-year program. I had no student loans. I got some scholarships and was able to pay the tuition off. When I got my bachelor's degree, I was already working as a registered nurse. So my work actually helped me pay for that bachelor's degree. And so again, I was able to get that back in the day. These were correspondence courses. Now they're all online. So you can get your associate degree in nursing from ICC, and then you can do an online program to get your bachelor's degree in nursing if you so desire. When I got my master's degree, I literally started school. My first husband passed away from cancer, and I started school to get my master's degree 12 days after he died. So some people would think that was a mistake, but he had been sick for many, many years with cancer. And I had done a lot of the grieving that one would normally do early on when I knew he was getting sicker and sicker. And so by the time he passed away, so much of the grief process had already taken place. And it was a good time for me to be able to focus on something else. And so I was actually paid by the state of Illinois to go to school as long as I would agree to teach when I got done. And at that particular time, I was already teaching part-time at ICC. And I thought, man, this is a great opportunity for me to just get my master's degree, not have to pay for it, and get more schooling. So I did that. I got that degree, and then I went right back into school and got my doctorate degree. Now, my work paid for those classes as well, so I didn't have any student loans there either. I would turn in I would pay it first, and then I would turn in the receipts to the school once I showed them my grades, to my work, once I showed them my grades, and they would reimburse me for everything. And then I actually went and got a postdoctorate certificate as well. I was a board certified clinical nurse specialist, so I could work in the hospital, admit patients, round on them, do everything that an inpatient hospital physician could do. But I wasn't certified to be able to take care of babies and children. And I was doing a lot of mission trips at the time and really wanted the opportunity to have more knowledge. So I actually went back and got my postdoctorate certificate as a family nurse practitioner. So currently, the next slide talks about that currently I'm teaching online at 4 different colleges. So I don't ever have to show up to work. I can sit at home in my living room and grade and participate in discussions and have students do WebExes with me, Zoom calls with me. And routinely for me, what I do is I get up very early. So I do my first 2 hours are in the morning. I'm just going through the different courses of each of the colleges that I teach at and update things and post some comments, post some questions. And then I kind of spend, my routine is I spend all day Monday grading assignments that everyone's turned in over the weekend. So Monday is my busy day. And other than that, I spend about 2 hours a day doing online teaching. And then I also live in Florida 6 months out of the year. So when I'm in Florida, I'm actually seeing patients 1 day a week at a clinic there. And we see those that are living in the poverty level. They can live up to 200% over the poverty level, and they have no insurance. So we see very vulnerable populations there. And then when I'm in Illinois, I actually work at a volunteer clinic about once a month on a Saturday in downtown Peoria, actually. And then the beautiful thing about teaching online is I can travel outside of the country and still teach every day. So my husband and I, when it's not COVID, we do about 3 medical mission trips a year. We go to Guatemala, we go to India, we've gone to Haiti, we have gone to Brazil. So these pictures here are some pictures of me seeing patients in Haiti. So the story about the twins that you see there on the screen is I had actually gone to Haiti as a clinical nurse specialist, which meant I really wasn't certified to see pediatric patients, but we, because the need was so great, and I did have some experience with peds, I was still seeing them. But I went on a trip and I was supposed to have a pediatrician there with me, and the pediatrician had to cancel at the last minute. And so I was the most experienced nurse practitioner on the trip, and they brought me a couple of really tiny, these are not them, but it reminded me of them, really tiny 2-pound septic twins. And not having as much experience with peds and not having the certification I needed, I was almost in tears because these babies were so sick. So I walked into the pharmacy and I talked to the pharmacist and I said, you know, I kind of know what I should be doing for these patients, but I really want to just run it by you. And lo and behold, my pharmacist happened to be a pharmacist that worked in a NICU and only took care of tiny, tiny, tiny sick babies here in the States. And so when I went home from that trip, I signed up to go back to school. And that's when I became a family nurse practitioner postdoctorately, so that when I would go back on these trips, I wouldn't be in that situation again where I had to rely on somebody else just to make sure that I knew what to do to help the babies. So if you see the other picture, kids love to listen to my heart. So I often teach them how to listen to a stethoscope as well. So the next picture is if you see the picture of that group of people. So when we go to Haiti, they know 2 months ahead of time what the dates are that we're going to show up and work at this clinic. And probably 2 or 3 days before we ever get there, people start lining up and they will walk for hours to get to our clinic. And some of them have tiny little babies. And some of them are super sick and they literally wait outside, lined up like this overnight until we can see them. And there's times there's 400 or 500 patients lined up before we ever even arrive. And so it's really heartwarming to be able to provide care for these people and to be able to help them. And in this little baby here, we like to see all the babies. We encourage moms to bring all the babies back for well baby visits, so that we can make sure that they're growing and that their nutritional status is good and that they're not developmentally behind. And we help provide supplies and nutrition for the mom and for the families. This next slide, you're going to see this little boy from Haiti. We call that a worm belly. His little belly is absolutely completely full of worms. And so because oftentimes these kids are playing in the dirt and eating food that's not clean and just not living in a good environment, you see a lot of these little worm bellies. And the other picture is the picture of this clinic that we go. And it's really awesome because this clinic was built by several people from Peoria area. And many physicians and nurse practitioners and nurses and EMTs from Peoria area go down and staff this clinic every 2 months. So every 8 weeks, they go back and they provide medical care to all of the people that we actually give them return to clinic cards, and we provide all of their medication and give them refills and just do everything we can to help them. The next picture is in Guatemala. And so my husband is there. He is not a medical person. He was the senior vice president of Ameren before he retired, but decided that he wanted to go on some of my medical mission trips. So here he is working in the pharmacy. So we put non-medical people to work when we go out of the country as well. And this is at a school. You see all these school children around us. We actually run our clinic out of the school. That way we make sure that we're seeing all of the children in the school, all of the teachers, all of the family members of all of the school children, and then we open it up. After we've seen all of those people, we open it up to people in the community. And so again, it's super rewarding to be able to go back year after year and see the changes in these people and to see their health improving and to see that we're able to treat blood pressure problems and treat blood sugar problems. So the next picture is us actually, the picture of the home is actually a home visit that we did. Their homes are extremely poor. They have dirt floors. They have fires. They cook their food, their daily meals on open fires inside of their house. And so one of the issues that we see repeatedly all over Guatemala and many of the countries that we go to is a lot of chronic coughs, a lot of respiratory problems, because these babies and these children are inside this house with the open fire, very little ventilation, and that's how moms are cooking. And so one of the things that we've been able to do is partner with another organization that helps provide stoves with ventilation and teaching these people to not cook on open fires. And those that were not able to get a stove for, we try to encourage mom to have the baby outside anytime that someone's cooking on the fire, and to try not to have, baby and to try to inside the house and to try to have as much ventilation as possible. So the next slide is again with Guatemala. And this is kind of fun because this is something that you might have an opportunity to do if you do end up going to nursing school. This is a group of students that I actually took to Guatemala. I took students to Guatemala, I've taken students to Haiti, and I've taken students to India. And so this is me with a group of nursing students. They get credit for this as a course, and they're working with vulnerable populations. They're doing home visits. They're working with me. I'm the provider, and so they're assisting me as the RN students, and I'm teaching them a little bit about how to do a head-to-toe assessment and a little bit about medications. And so these students actually got an opportunity to go with us. The next slide is from Northern India. Now, this was a great opportunity that my husband and I actually started a medical clinic in Northern India. There's a home there that we partner with. We go there once a year. And if you see that there's 4 nursing students in this picture, but there's actually 5 that just graduated. This home takes in girls. Most of them have experienced some kind of sexual abuse. Many of them have been sex slaves. And so they've rescued these girls, provided them with an education, and there's 5 of the 140 girls at this clinic that went to nursing school. So I was able to go over there, talk to them a little bit about my journey, teach them a little bit about nursing. I see all the girls as patients. I see some of their family members. There's a school right next door, and I see all of the students and the teachers at that school. And so they had an empty building there. It was not set up like a medical clinic, but we wanted to build a 4-room medical clinic out of this empty building. And so we asked how much it would cost, and we were doing a lot of work. We had to put walls up and had to put sinks in and had to put a bathroom in, put air conditioning in, put heating in, put beds in, cabinets in, sinks, everything. And when the contractor came back and said, I can do all of that for $5,000, we were shocked. That was unheard of. That's super, super, super cheap. And so a physician, Dr. Ravi Masih, and my husband and I split that cost and built this medical clinic. And now they get other teams and us that are able to go over there at least twice a year. I'll go once a year, and then another team comes another time a year. And we're able to use that clinic and see all kinds of people in that community. So the next slide, again, you'll see my husband at this particular clinic in India. He's actually checking in patients, and with the help of an interpreter, he's finding out what their chief complaint is, what's wrong with them, what are they there for, does their ear hurt, does their belly hurt, and then writing it down for me so that when I come out and get the patient and take them back, I already have a little bit of an understanding of what I need to focus on. And then this is just one of the little girls at the clinic. So the next slide is one of the issues when you have 140 girls living in one environment. We all know how fast head lice can go through a classroom. Well, one of the times I was there, we had several students with head lice. And so we were teaching them how to do treatments on each other. And, you know, the slide where they're doing the shampoo, we gave them the right kind of shampoo to use. And then over here, we're teaching them how to pull the little nits out so that we can get rid of the head lice there. But again, it's things that we take for granted here in the States that many people in other countries just don't have access to the simple things like head lice treatment. And so we were really grateful to be able to do that. The next slide, leprosy. We rarely hear the word leprosy in the United States, but there are actual leper colonies all throughout India. And we were able to go visit one. I was able to actually go and see patients there. And we were able to take them some food. In India, once you are a leper or you are born into a family where your parents, one of them are a leper, you're not allowed to be out in the community and work. And so these people are often extremely poor and often have no health care. And so we were able to actually go and help them, provide food for them. And then this clinic in India takes food to them on a monthly basis. The next slide is where we're actually giving them some food. We're giving them corn and giving them some rice, and we gave them some beans, and just try to make their life a little bit simpler because all of them live in one small little community building. And we wanted to do something to try to help them. Now, the next slide, another opportunity I had was to actually staff a floating hospital on the Amazon River in Brazil. And so this is the floating hospital. They needed a nurse practitioner or a physician to come and actually go up and down the Amazon River, stopping at specific villages and providing medical care to the people that just don't have access to any medicine whatsoever. And so what was really interesting is we would see these little dugout canoes with families coming towards our boat because they knew when we were coming. And we were able to see many, many patients. I was seeing probably 70 patients a day myself, and we have a pharmacy on board and we have a dentist on board. So I would be seeing them for the medical side, the dentist was seeing them on the dental side, and then we would have a pharmacy we could send them to get medication. The next slide, another, there you go. We were doing a house visit, and this little baby had been born at home and was actually doing really well, but we were doing a well baby check. And then this is how the families will arrive to the boat on these little canoes. And you see, 1, 2, 3, 4, 5 people on this little bitty canoe that looks like it's being run by a lawnmower on the back. And that's how they come to the clinic and get medical care. The next slide is me having a little bit of fun with one of the fish that actually I did not catch, but one of the crew members had caught. And then again, letting the kids, just kind of play with the stethoscope. And here I'm listening to his heart, but I had just let him listen to my heart as well. And so letting them see how our equipment works so they're not afraid of it. So as you can see, for me, that's my graduation picture from ICC many, many years ago. But nursing has been an amazing career for me. It's provided great versatility for me. I've worked in the emergency departments. I've worked as house supervisor. I've worked on a medical surgical floor. I've taught. I've worked as an advanced practice nurse. I've been all over the world being able to use my nursing skills. And like I said earlier, I've not had a single job that I didn't absolutely fall in love with. In fact, when I would be offered another job, it was really hard for me to leave because I had made so many friends, and it's kind of a cycle of what we call novice to expert and back to novice again. So when I worked in the emergency department, I became an expert about emergency medicine. And then I left that and became a house supervisor. Well, then I was a novice again. I was trying to learn it all over again. And so every time you think you've arrived, when you change positions, you start off learning again. And so I think that's one of the things that I liked about nursing is you can never learn it all. There's always going to be something to learn, something new to conquer, a new adventure to have. And so it's just been an amazing journey for me. So the next slide is, it's given me an amazing career. What I didn't finish telling you about the story, about my dream, I'll tell you now, is so in my dream, I thought that my husband had died, and my husband wasn't sick at all. And so there was no reason to think that he was going to die. And so I went to nursing school. I graduated in May with my nursing degree and started my first job in June. And in August of that year, right after I graduated, my husband was diagnosed with cancer. And so he lived 12 years, but I learned really, through that experience that it was important for me to have a way to financially care for the family. Because if I had not planned ahead, I think it would have been almost impossible for me to go to school while trying to care for him, having cancer, having foster kids, raising my own kids. I think that would have been very difficult. And so I'm very grateful that I had that dream, and that that I listened, and that it gave me an opportunity to care for my family after my husband passed away. It's given me an amazing road to education, that fortunately I've not had to go into debt for. It's given me an opportunity to give back locally and globally. We've, like I said, I serve at a clinic here in Peoria. I serve at a clinic in Florida. We've gone all over the world serving and trying to help other people that are less fortunate. It's given me friendships that have lasted a lifetime. And I'm still very good friends with people that I went to nursing school with back at ICC many, many years ago. It's given me financial freedom. And it's given me a lot of personal growth and leadership skills. I've learned so much about leadership. And again, giving back to the community and being able to start endowment scholarships to be able to help other students. It's just been an absolute amazing career for me. And like I said, one that I haven't had to invest a lot of my own finances into. So now you get to decide if nursing or healthcare is a good career choice for you, or let me know if there's any questions that I can answer.
Yeah, thank you. Thank you so much, Phyllis. That was so informative and helpful. And I'm sure that, a lot of our youth, that might be a really good option for them to go into healthcare. So right now I'm going to give everyone a minute or two. If they have questions, just type them down there in the Q&A box, and Dr. DeWitt will take some time to answer them. So just give everybody a second to put their questions in there.
Well, we actually have a medication that we give them, and it's just a pill that they have to take, and it kills all the parasites, and it's an anti-parasitic medication. And if they're really little, we give it to them in liquid form. And if they're older, we give it to them in pill form. So a one-time dose, and all of them are killed, and they lose that big, huge belly that they have, and they start feeling better, and they're able to start growing a little bit better too. How long does it take? Oh, the question was, how do you treat a worm belly? I'm sorry, I should have read it. The other question is, how long does it take to graduate to be a nurse? So if you're going to go to become a licensed practical nurse, you can graduate after a year. If you're going to like a local community college to become a registered nurse, it would take 2 years. Or if you're going to get your bachelor's degree, it would take 4 years. So you can become a registered nurse with a 2-year degree or a 4-year degree. How do you get funding for the medication? A couple different ways. We actually have some pharmaceutical companies that will donate medications. And we also do fundraisers where we're raising money and we can buy medications. Like it depends on which organization you're talking about, but some organizations actually have a contract with Germany and they'll buy medications out of Germany. In India, they actually have local pharmacies and the medications are extremely cheap. And so we actually go there and buy the medications when we were actually in India. So there's multiple different ways, but through fundraising, donations, and just purchasing medications once we get there. Those are great questions, though.
We'll give another few seconds if there's any other questions, but you probably answered most questions. Either are really informative and oh, there's another one.
Oh, can we go to there and give them COVID vaccines? We can if we can't, well, I can't say that we can't. Like right now, India's closed, so I can't even get to India. And they have very, very limited vaccines there. But there are some missions that are opening back up, and we can take COVID vaccines to them, or we can use the COVID vaccines their country already has access to, and then we can actually administer those vaccines. So there's a couple different ways, but many of the countries have been very closed in the last year and a half, which has been really hard. But fortunately, we're still getting updates from many people, from many countries that they're still doing okay. If you're not in the medical field, how can you volunteer, and what are the jobs in which you can volunteer for? Again, it depends on which mission you're talking about, but like Guatemala and Haiti, they take non-medical people and they let you register. They'll teach you how to weigh patients and teach you how to get their height. They might have you working in pharmacy where you're counting out medications and helping to package them. So there's many jobs that people can do, even if they're not in the medical field, but they still want to go on a mission trip. My husband's gone on many mission trips, and one of his favorite jobs, honestly, is to be in the waiting room and entertain the children while the parents are being seen. So, but he's worked in pharmacy, he's done medical records, he's done crowd control. As you saw that picture in Haiti, those crowds can get a little bit unruly at times, and he's gone and done crowd control or helped pick out patients that needed to come back faster and said, this patient looks really sick, they need to come back quicker. So there's many jobs that you can do. Good question. Wow. So I can tell you every trip is different. When I was in Haiti, I saw, and this is very unusual, so let me give you an example of what we see in the States. In the United States, we would normally see in an 8-hour day about 16 patients. So that's normal. In Haiti, I would see about 75 patients a day. In India, I would only see probably 30 to 40 patients a day. And so it really depends how many providers you have. Like when we go to Haiti, in a week, we see over 3,000 patients, but that's if we have several different healthcare providers. But when I go to India or Guatemala or Brazil on the Amazon River, I was the only provider. And so it's harder to see that many, but I would see sometimes 50 patients a day on those trips. Oh my gosh. Well, I already have 10 adopted children, and one of my daughters finalized an adoption today at Peoria County Courthouse. So we've continued that, but it is so hard not to bring all the children home. So when my husband died, I had adopted 7 before he passed away, and I adopted 3 more that first year after he died. And then I had 3 biological children. So when I met my husband, my second husband, and told him I had 13 children, I think it scared him a little bit. But so I think we're probably done adopting, but it is very tempting that you just want to bring home a lot of these children. They're just precious and beautiful. You guys have had some great questions. Thank you.
Yeah, those were really great questions, and thank you for answering those. Yeah, to everyone viewing tonight, thank you for joining us. I want to again thank Dr. DeWitt for being with us and giving such a great presentation. Oh, we do have one more question there. If you want to answer that real quick.
Well, this is going to shock you as well. I fostered over 100 children in about 30 years. I probably the last 26 years specialized in mostly sexually abused girls that had failed multiple placements. And so we had a little bit tougher challenges at times, but I fostered over 130 years.
That's awesome. Well, yeah, again, thank you for being with us.
Thank you.
Just want to say, join us next month. Everyone out there, join us next month for CASA Choices again. It's going to be on Wednesday, September 15th, and we'll be hearing from someone in the social work field. So thank you again, Dr. DeWitt, and everybody have a great night.
Thanks.